Ya no, hasta para irme, ya no podía irme por los carros, pues te da miedo, vayan a tentarme por ahí los carros, ya no salía.
Está él desconsolado de su trabajo, pues. Y ahora hace un año que ni trabaja nada.
Aquí, por ejemplo, yo veo el reflejo del sol, pero ya no distingo las personas y desde lejos ya no puedo caminar para lejos.
Constantemente pidiéndole a Dios por mis hijos y por mí.
Across Latin America, there are millions of people who suffer needlessly from cataracts and other serious but treatable eye conditions. These people live in the shadows, unable to work, feed their families, and lead productive lives. Many lack proper nutrition, sun protection, and access to even the most basic medical care. Cataracts are the leading cause of treatable blindness, afflicting over 20 million people worldwide. Without treatment, the prognosis is grim. A recent World Health Organization study showed that on average, people in the developing world die within 4 years of becoming blind. Even for the young and healthy, lack of access to eye care can impair development and significantly limit educational opportunities.
Entonces el acceso a una atención oftalmológica está limitada por la escasez de los servicios. Entonces el paciente no asegurado para tener acceso es very expensive. Entonces no va a poder, no tiene acceso.
El que no tiene plata, pues como le digo, se muere.
Vision Health International is a private non-profit organization that is dedicated to restoring sight to those in need. Each year, teams of medical professionals and volunteers travel to developing countries in Central and South America to provide professional healthcare services free of charge to people with impaired vision. Working with local communities, Vision Health provides such critical services as cataract removal and oculoplastic surgeries, eyeglass distribution, and free vision screenings.
VHI is the only hope for many of these people. We've been in many hospitals similar to this where there's great large buildings, but they have zero supplies, and it's very difficult for them to do any of the work for these patients.
The people that are standing outside waiting for us, I think they feel as though this is their one shot at regaining sight.
I think bottom line is to make a difference. If we don't do this work, the patients just aren't going to have it done. They're going to remain blind for the rest of their lives. So it's nice to make a difference in a person's life.
Ya no puedo hacer nada, pues no, estoy mal. Ya hace un año ya, ahora en mayo cumplo un año ya que estoy así. Ya.
Me pegué un golpe en una zanja y ahí es donde ya me cogió más oscuridad mi vista. Ya de ahí ya no pude salir ya a trabajar, ya abandoné todo.
Ay, hija, dice que como tú no tienes, pues tú no te pasa esto, no, tú estás tranquila. Le digo, no, papá, yo también estoy preocupada, le digo, porque yo ya me imagino cuando uno llegue a la oscuridad de no ver nada, qué desesperación no será, ¿sí?
Bueno, a veces sí, chiquitos de por acá, pues no me gusta que salgan porque poco los tengo más acá adentro, si le dicen así, vizcacha, virola. O sea, sí, pero yo le digo, no les hagas caso, pero ella no les hace caso. Como, bueno, no sé, como toda madre, pues verla crecer y ser otra.
As the VHI team unpacks donated supplies and prepares to see patients, a line of anxious people stretches into the streets. Some have already spent days traveling from surrounding rural areas, and many will sleep outside the clinic, hoping for a chance to see one of the doctors.
I do have a minus lens.
People come through the clinic doors, especially the ones that have blindness. I mean, their face tells it all. I mean, they have this look on their face that says, I need help, please help me. And, you know, there's a communication that goes beyond language. And they say, I'll try to do the best I can.
Okay, entonces habla
¿Puede ver la luz ahora? ¿Puede ver la luz?
No.
Patients are first screened to determine the nature of their eye condition. In some cases, surgery will be necessary, but for many patients, a pair of eyeglasses can make an enormous difference.
But truly, a pair of glasses can change someone's life because it's a visual world. If you can't see, it's hard to function sometimes. So.
The nice thing about VHI is we do tend to utilize a lot of different people. Because we're doing eyeglasses in addition to doing surgery, there's a lot of opportunity for non-medical people or people who don't have a specialty in eyes to help out.
And when they can actually see your face or see your eye or able to read their Bible, I think that's the most fulfilling experience because they really need it and we're here to help.
For patients who do require surgery, Vision Health's team of doctors and nurses can provide life-altering operations, restoring vision and reclaiming hopes for a normal and productive life.
Claro, sí, después de la operación ya, una vez que quede bien, quiero trabajar para seguir adelante, ¿no? Y ayudar a mis padres. Tengo dolor 2 por cada 6 horas.
Exactly. Sí. Okay. I really enjoy it when it's something that's fixable. One of the reasons I like doing eye trips is because it is something that you get somewhat of an immediate gratification with. In many medical areas, you don't. Whereas with this, the change occurs the very next day.
Hola, ¿se ve algo?
Sí.
Ah, sí, aquí está su doctora, se ve su doctora.
La doctora, ¿cómo está?
No hay mayor satisfacción que la alegría de ver a un paciente devolviéndole la visión. Es una cosa muy gratificante para el médico tratante. Eso es un agradecimiento de toda la vida. Eso no puede compararse con ningún regalo material.
El plano, ahora ya ve.
Ahora ve, ¿verdad?
Sí, ahora ya.
Yeah, he's just really
ya, ahora ya.
goes from
Las sillas también.
Incredible. It's incredible how well he can see. He has not been able to see these things for so long. He can see the floor, he can see us, he can see the chairs. He just couldn't see anything.
Ahora
And now
veo los pies de los. Ahora
se
ya.
siente contento, ¿no?
Sí, va, está también.
There's really no better feeling for me than when I'm part of the VHI team and someone gets their sight back, you know, that I originally saw in clinic, who was so hopeful, waiting to find out, am I going to get surgery? Are they going to tell me that there's something they can do for me, that I might be able to see again?
Ahora que alcanzo a ver, ya voy a poder trabajar, ¿no? Yo solito, movilizarme ya, sin que nadie me guíe. Y así podré pasar mi vida ya mejor, porque ahora estoy alegre, ya contento, porque ya veo.
Sí, ahorita ya salgo, ya sin miedo, ya veo las motos, todo. Antes no, pues tenía yo algo de miedo.
Ay, con un beso vale, ¿cierto?
Buena suerte.
Gracias.
The best part's been, watching the post-op, all the
patients, you know, seeing for the first time in a long time. It's super cool. Like it's the coolest thing I've ever been a part of.
Les agradezco a ustedes por la ayuda que le han hecho a mi suegro, porque no había nada, ¿no? Sí, el agradecimiento yo de ustedes, yo le voy a poner a mi hijo esto, Randy, del doctor quien ha operado a mi suegro. Randy.
And no matter how anybody participates, be it if they donate a pair of used eyeglasses, if they donate money to help buy supplies, or if they actually volunteer, each person, no matter what they do, actually gives somebody the gift of sight.
One of the great things about working with the VHI team is that once you're with them one time, they become your family. Everybody are there for the patients and really make you feel close.
There's no question that these services are life-altering, not only for the patient, but also for the provider. Many, many times physicians, especially the physicians, the surgeons on these trips, will come to me at the end of a trip and say, this is what I went to medical school for. This is the kind of medicine I had intended to practice when I wanted to become a physician.
In spite of all these efforts, at the end of each trip and each morning, there are countless people who are still waiting to get a turn to come see the ophthalmologist. And at the end of each trip, we leave many people who still would love to have the opportunity to be seen by the doctor. And for that reason, we need to continue to grow, to provide more surgical missions, to recruit more volunteers, and to provide even more services to the countless people who would never otherwise have the opportunity for the gift of sight.
Los que no tienen tickets no vamos a tomar más gente. Lo siento, yo siento muy mal sobre eso, pero...
That's one of the saddest parts of the trip is when we realized that there's just not enough time.
That is the hardest part. When we are out of time, we're out of resources, and we have to say, lo siento, I'm sorry.
Our future is that we need to see as many people as we can, as often as we can, because it's overwhelming and staggering the amount of people who simply do not have access to eye care.
In some way, at some level, it contributes to balancing out the good and the bad in the world. And this organization is an opportunity to do only things for the good. And if we could all do that, it would be a wonderful place.